Hello, welcome to our webinar tonight. The topic of our webinar is headaches, migraines, and vertigo. This is Lisa Humfeld-Wilson with Humfeld Chiropractic and Nutrition Center located in downtown Faribault, Minnesota. Headaches, migraines, and vertigo are very common conditions that many patients have suffered with that we have seen throughout my 15 years of being in business. So we're not going to talk so much about what these are tonight, but focus on how chiropractic can help and how spinal alignment is a big part of that. So we're going to briefly touch a little bit about each of these, but for those of you that suffer from one of these conditions, you already know about what they are. But for those of you who might only suffer from one of these and not some of the others, we're just going to briefly touch on what those are. So I saw this picture, and it made me think a little bit about, what people are doing if they have a headache. So many prescriptions that are taken for headaches can actually contribute to the headaches. And so oftentimes people don't realize that they can kind of become this almost vicious cycle. And so it's something that we kind of need to be aware of. And I've actually have seen a few cases like this over the years where those medications can actually, trigger another headache. And so it's just this constant cycle. So some of the different types of headaches that somebody may suffer, these are the more common ones. So kind of a sinus headache. And that's going to be where there's pain kind of behind the forehead or maybe even the cheekbones. And then there's the cluster headache. So that's going to be pain is in and around like one eye. Then you have the tension headache, and that's going to be where pain is like a hand squeezing the head. And oftentimes you're going to see that kind of above the eyebrows and the forehead area, okay? Then you also have the migraine, and that's going to be the pain, the nausea, the visual changes are very common of the classic form of a migraine, and sometimes that's going to be on one side more than the other type of thing too with the migraines. So headaches don't always have to be, as you see in the picture here, in the front. Some of them might start more in the base of the neck and kind of wrap up over the head as well. So there's many different ways a headache can start, and obviously different types of a headache when somebody is suffering from headaches. So when we're talking tension headaches, these are actually often result from stress or even bad posture. So bad posture can aggravate the spine, the muscles in the upper back and neck. So think about the type of work that you do. Are you spending hours every day sitting in a chair where the muscles in your neck and back have to carry the weight of your body rather than being supported by the spine? Now, this can also come in from all the technology that we have available to us these days. So not just computers, but the poor posture that we get from constantly looking down at our tablets or our cell phones or something like that too. That creates tension in through the neck and can actually lead to some of those tension headaches. So these headaches are not just seen in adults anymore. We're seeing these in high school students, grade school, middle school students, because technology has really been added to our everyday work, even in school. We're in a school district where they hand out iPads to everybody 6th grade on up, gets their own iPad. And, even in the elementary classes, I know the students are using iPads even in those classes as well. So they are definitely available to everybody. But that sitting, looking down can create a lot of tension, and that can lead to some of those tension headaches. So chiropractic care has the ability to reduce both the intensity and the duration of tension headaches. So there was a study done back in 2010, and it looked at tension headaches as the result of stress or bad posture, aggravating the muscles in the upper back and neck. And by releasing the stress, reducing these kinds of headaches, we can do that with chiropractic. And this comes from the Journal of Manipulative and Physiological Therapeutics back in 2010. So it is something that has, even has some research done how chiropractic can be helpful, not just in reducing the intensity, but also helping with the duration of those tension headaches. Now, headaches may come without warning, but migraines often come with a warning: nausea, tiredness, or visual disturbances. So that's one of the distinguishing factors between a headache and a migraine. So again, oftentimes they are very gray and white, or kind of a gray area between headaches and migraines. Um, some people that have headaches every day, to those people who don't have that kind of thing, would have a very low tolerance and not be able to adapt very well. For somebody who has headaches or migraines every day, it's really kind of a different world when they are able to have a day or a week, or even a month where they don't have those headaches or migraines. So it can make a night and day difference for them. So two major types of migraines. So there's the classical migraine, and this is the 10 to 15% that actually have an aura with the migraine. And then there's more the common migraine. And this is 85% of those migraines are happening without an aura. So with the common type, those might be triggered by blood sugar changes, sometimes certain foods, smells, hormonal changes, stress, and even fatigue. So those are definitely something to kind of keep an eye out for. So the impact of migraines. People don't realize that these migraines can have such a dramatic impact on not just our health, but the economy, the world in general. So migraines are the sixth most disabling condition in the world, and 38 million Americans get migraines. 1 billion people worldwide get migraines, and these migraines, when they come on, could last between 4 to 72 hours. And we're talking 2-3 days here for some of these people that these are lasting. And sometimes if you've got 15 or more days of a migraine, then that's considered more of a chronic migraine. And over 4 million people are getting those chronic migraines. So, and there can be a history of these migraines that run in the family. So about 90% of people with migraines have a family history of the condition. So it's interesting that, again, oftentimes we can see even the family history of those migraines running in the family. So this picture here kind of shows what the world might look like to a person who's suffering with migraines. So you can see here kind of a blurry picture. So our job with chiropractic is to try to bring that person who's suffering from those migraines, bring their life back into focus so that they are able to see things as they really are, and help them get through their daily lives, because it's not fun if you are going through and not enjoying your life. So migraines definitely make life hard. So upper cervical chiropractic is a proven treatment of migraine headaches and migraine symptoms. And I like this picture because sometimes that's what it feels like. You just got this huge weight on your head or neck, and it can be kind of weighing things down. And oftentimes these people, first of all, they don't even want to get out of bed, so it can limit their work productivity. Maybe they have missed several days of work. I have seen cases over the years. I recall somebody was on the verge of losing their job because of the amount of work that they had missed. And we were able to help their migraines and headaches, and they were able to keep their job and actually perform even better in the job, leading to a promotion. because they were feeling better and were more productive at work. And so improving your health cannot just, with cervical chiropractic, it cannot just, help you relieve those symptoms, but in this case, it led to more productivity with her family, with work, and also resulted in a job promotion because she was actually there and could function. And so it is really about how do you want to get through life? How do you want to get through your workday? So now we're going to talk a little bit about vertigo. So we've got this little picture here, and for those of you who like us on Facebook, maybe this is something that you've seen on our Facebook page. But the vertigo, when you're looking at this, sometimes it can be a condition where you feel like the room is spinning. So this can happen sometimes when we're laying down. Sometimes this can happen as we're going from laying down to standing up, or from even sitting to standing. So sometimes it's more of a positional change. So it can be a positional change in up or down, but it can also be a positional change as we even turn our head or tilt our head in a certain direction. So the vertigo can happen, and there's, different types of vertigo. Some of these are actually maybe have been diagnosed as Meniere's disease as well. And so there's it is a chronic condition that a lot of people have had to deal with very little results in any of the changes. So the cervicalgenic dizziness, this is a condition or syndrome where there's disequilibrium or disorientation in patients with neck problems. And one of the things that they have found is that this cervicalgenic dizziness starts in people with these neck problems, and maybe those neck problems are a result of cervical trauma, so trauma to the neck, whiplash, maybe there's even some arthritis or degeneration. So we have a picture here of an x-ray of somebody's neck. And so when you're looking at the computer screen, you can see the teeth on the left, and the spinal bones in the neck are on the right there. And where that yellow circle is showing that there's some cervical arthritis and degeneration starting, and obviously a significant loss of the cervical curve on this picture too. And this can lead to some of that cervicalgenic dizziness or the vertigo type symptoms that somebody may be suffering, in addition to maybe headaches, neck pain, and some other things as well. So the nerves in that spine can greatly be affected. So when we're talking about upper cervical alignment and the upper cervical chiropractic, the concept is pretty simple. If you look at this picture, on the left is the aligned picture. So you can see that the head is on nice and straight. And the little red area is the brainstem. So that's close to horizontal line there is drawn through C1 or atlas. And then you have the vertical line drawn through the skull and the bones in the neck. And you can see there that everything is square, and if you were to measure those angles, everything would be right at 90 degrees. That's the ideal position. But if you look at the picture on the right, the misaligned picture, you can see that we still go through C1 or atlas with that, which was once that horizontal line, not quite so horizontal anymore. And then you have the not so vertical lines either. And so now you can see there that the brainstem can actually be, that red area underneath can actually be a little pinched and have some interference in there because of the alignment at the very top of the neck. And it is this alignment that can cause significant problems in how our body responds when we're talking headaches, neck pain, migraines, or even the vertigo. So our goal with upper cervical chiropractic is to, first of all, find this misalignment at the top of the spine, and then go in and make the correction so that our ultimate goal is to make your neck look like what you see here on the left in the aligned. So that's when those first two bones called atlas and axis, so atlas is C1 and axis is C2, are then properly aligned, and then your head is on straight, and your brain can actually and effectively communicate with your body to achieve the optimal function. So that's our ultimate goal with upper cervical chiropractic, is to focus on the alignment at the very top of the neck, and that alignment can then determine how the rest of the body will follow suit. So with this type of chiropractic, we've been able to help people where not just suffering from headaches, migraines, and vertigo, but this alignment at the very top of the neck can even impact all the way down to the lower back, the knees, the feet. And so if there's a problem way up in the neck, you can have a problem further down. And that problem, again, may start in the neck. And so with this type of chiropractic, I can adjust somebody at the very top of the neck and help align their lower back, their knees, their feet, that type of thing. So I've had a number of farmers who, sitting on a tractor, they're doing, they're out in the field, they're turning around, they're developing lower back pain. Some of those farmers are also milking cows, and depending on their setup in the barn, they may have to squat to still wash those cows before they put the milkers on. And so then we see some of the knee pain. I mean, I've even got a patient who's been with me now for 15 years, and her main reason for coming in, even 15 years ago, was for tingling in her feet. And we never adjusted her feet, and only adjusted one of the first two bones in her neck. And that alignment at the very top of the neck could help with the tingling all the way down in the feet. So this upper cervical adjustment is a really big deal and can help with so many different things, in addition to the headaches, migraines, and the vertigo. So the anatomy of the upper cervical spine. So what this looks like, and the reason I wanted to show this, is you have the skull, and then you have the yellow area here in the picture is the brain stem and the spinal cord. And then you also see the vertebral artery. So you actually have an artery passing through on either side of C1. And where that artery is passing can actually, when we're talking about that misalignment, as we were on this last slide, that misalignment that you see here on the right can actually cause the blood flow, when you're looking at the spine this way, to not be functioning like it's supposed to. And this is where those migraines and vertigo symptoms and even the headaches can be impacted, because the blood flow in and around the brainstem area into the brain, out of the brain, is not working the way that they're supposed to. And that is where the significant change in our health conditions can come from. So that vertebral artery is so important, because as that bone moves, it can actually block some of that blood flow. So our job with upper cervical chiropractors is to get that joint back in alignment and restore not just the nerve function and the nerve flow, but even making sure those blood vessels and like the arteries are working and getting the blood flow through like they need to as well. So a little bit more anatomy of the upper cervical spine. So you can see here, number one, there's misaligned vertebra that can pressure blood vessels and irritate the spinal nerves. But then you have those pressured blood vessels reduce the blood flow for the brain, and the irritated nerves may tell vessels to narrow. And then it's going to reduce the blood flow even more. So now, because of those blood vessels are reducing that blood flow to the brain, they're narrowing down, things aren't moving through as fast. And then those blood vessels in the head expand to offset the reduced blood flow supply. And this can increase, sudden expansion irritates the surrounding nerves and the throbbing pain of a migraine. So you got that misaligned bone, and it's cutting off the blood flow that's supposed to go to the brain, and then the blood vessels in the brain are going to compensate by expanding and reducing that because of that blood flow supplied. And then you have that expansion in the brain and the blood flow kind of, so you kind of got this where it's like two different traffics going in one direction. So the brain's going one way and they're trying to compensate, and then the misalignment, or we often will call it in chiropractic subluxation, is blocking the blood flow going to the brain. So you kind of got this little traffic jam, even within your blood vessels, of what's going on in and around the brainstem area. So the bones can have a huge impact on that as well. So some of the symptoms of a C1, C2 subluxation, or if we're talking misalignment of the vertebra with nerve interference, that's what a subluxation is. So symptoms of a subluxation at that C1, C2 area, sometimes known as atlantal axial instability. So this is where somebody may be suffering from balance problems, maybe there's blurred vision, continuous head and neck pain, difficulty swallowing, dizziness, fullness in the ears, migraines, neck pain with no motion. Maybe there's even reduced activity. Maybe they're suffering from severe fatigue. Maybe they're the suboccipital headaches. So these are the headaches that kind of start at the base of the neck and then work their way up. Maybe the symptoms worsen with neck rotation. Maybe there's tinnitus, or also known as ringing in the ears, and then, of course, the vertigo. So there's a lot of things that can be tied in with symptoms of that subluxation at C1, C2. And so these are just a few of the things that can be results of the C1, C2 subluxation. So again, that's at the very top of the neck. Those first couple bones are not lined up the way they're supposed to, and they're putting pressure on the nerves, the nervous system, the spinal cord, and sometimes even the arteries involved. So what I'd like to offer you tonight for attending this webinar, because we talked a little bit more about the upper cervical chiropractic in our webinar tonight. For those of you that are interested in the upper cervical chiropractic, we are offering this initial visit, which is usually $265 with x-rays. Because you attended the webinar tonight, we are offering that visit at $135. And I do want to let you know that unfortunately this offer is not available to Medicare patients because that is a federally regulated program and we cannot discount any of those patients. However, we still will work with Medicare patients, but we cannot discount the services. Now, and if you are a current patient and are already working with us, even on the chiropractic or the nutrition side, you are welcome to share this webinar. And if you webinar and this offer that we have tonight with a friend or family member, and if you share it within the next week, what we are offering is that you will get $5 off your next purchase or visit by them coming into the office. So I'm going to go ahead and open it up for questions, and if anybody has any questions, I'd be happy to help.